Hello everyone, this is Dr. Valerie Mukanga. There's a problem that we see many times when, we see some patients coming into the office and they have missing teeth, so their teeth are missing, and we would ask them, are you interested in having your tooth replaced? And they say, no, I'm okay. But I'm here to talk to you about this. Why should I have my teeth replaced? Okay, so many people, when it actually comes to especially back teeth, they don't really feel the need, because those are not teeth that can be seen. They don't really feel the need to have those teeth replaced. But why is it dangerous for a tooth that is missing not to be replaced? Is what we're going to be talking about. So whenever you have teeth, right, we're supposed to have a full set of teeth, including wisdom teeth. Usually an adult person would have 32 teeth. And I say about because some people are actually born with missing teeth. They have missing, wisdom teeth, or even some people have, some teeth that are missing, were not congenitally there, so they end up retaining some baby teeth. That can be seen too. But say, for example, you had that person that, you had a tooth that was carious, so had cavities, and you now had to have the tooth removed. Why should you replace it? Number one reason why you should replace it is because missing a tooth is exercising, you are causing the other teeth to work too hard in those areas. That can be seen especially on people who have lost a lot of posterior teeth, or teeth that are found in the back of their mouth. So now they revert to actually chewing their food with their front teeth, and where the teeth are supposed to be something like this, where the top teeth are on top of the bottom and the bottom teeth are kind of like in the back, all of a sudden, and it's usually placed like in a straight form. Now because they are actually chewing more and trying to chew their food with their front teeth, which were never created for those kind of functions. It was more created so that you can bite inside through your food, so like you cut it, or with the side teeth you're going to be tearing the food that you're eating. It was not meant to be chewing food. So now all of a sudden, when you exercise too much pressure, your teeth are going to start splaining and take like more of like this position, right? So they move kind of forward. That messes up your bite. That can even lead to bone loss in some extent, and all those kind of things. So replacing back teeth is going to be essential, okay, for that matter. But say, for example, you have enough teeth in the back, but actually you have enough teeth in the back, you're just missing a few. What would be the danger of actually not replacing those teeth is number two. Number two, the reason why you want to replace those teeth, or the danger, is that you can end up experiencing supra-eruption. And that's just a big fancy word to say that, say, for example, if you had lost a tooth in the bottom, and then like your top tooth is not going to slide down, and it's going to take part of the place of that particular tooth that was missing, or those particular teeth that are missing. So that's another problem. And why is it a problem? It's a problem because later on, if you want to replace the tooth, now you may or may not have enough space to actually replace that tooth properly. There's in fact like this one patient that I saw this week, where she's now interested in actually having the missing teeth replaced, but the tooth has actually drooped down. So now what we're going to have to do is that tooth that has no problem, it doesn't have a cavity, the tooth that actually slid down, now we need to do a root canal, because if we kind of trim down the tooth that much, is going to start causing problem, because the nerve inside the tooth is going to be exposed. So now because of that, in order to actually create space, for another tooth to be replaced, so that she can have enough tooth structure to chew, because she feels like she can't really chew properly. She's only using the other side, but on the other side she also has problems. So now all of a sudden, on the tooth that's perfectly fine, it just slid down, she now needs a root canal. She now needs to have to have a crown as well, and that's on a tooth that does not have cavity. So now you are kind of sacrificing a tooth that would not have had any problem anyway if you had replaced the bottom tooth that was missing in a timely manner. So that's what we want to avoid, right? And then the third problem that we can see, that we often see, is that we have shift or drift, right? Whereby, say for example, you had a tooth on the side of that missing tooth area. Now, instead of that tooth being straight, it's actually sliding down. And when it does that, it's taking that space, the space of the area where the other tooth was missing. And so that too, if later on you want to replace the tooth to have more chewing surfaces, it creates a problem, because now when the tooth has slid down, you may or may not have enough space. If you don't have enough space, right, then the tooth may not be able to be replaced. If you do have enough space, but to put another tooth there, but the tooth has shifted down, when you actually replace the tooth and create a tooth, create a tooth on the area where the tooth is missing, what's going to happen is that you have that area that's more like in a triangular shape, right? And so now, because you cannot actually put material to cover that area, so now you're packing food there. So now when you eat, you have what is called food impaction, which means that your food gets stuck in there, and now it's very painful. When you have tooth that's stuck between two teeth because the space is too big, it's actually very unpleasant. It's very painful, when you're going through that. And so, many people, when they experience that, they may take like maybe toothpicks, and toothpick can also actually traumatize your gum. Okay, so that can be a problem too. Or sometimes if you want to use floss, it's very, very difficult to actually remove, the food that has been impacted or that's stuck between your teeth. And sometimes you can use also maybe like it's called interdental brushes, or little brushes that go between your teeth. But it's just very unpleasant that every time you eat, you have to now dig the food out of your mouth, because you did not replace those teeth in the timely manner. And it also messes up with your bite, right? It also messes up with your bite. So when you have a tooth that's missing, you actually do want to do your very best to have that tooth replaced as soon as possible, so that you can avoid those kind of problems. Shift of teeth or drifting. You can avoid also supereruption, where teeth actually slide down, taking that space, and also, the fact that you're not able to chew properly. And you can also exert, too much pressure on other teeth and shifting their position. Because when that happens, especially when you have those three problems happening, then all of a sudden, you find yourself increasing even the cost further of your treatment, because you may now need an orthodontic treatment, which is, getting braces or maybe clear aligners. But if your teeth have shifted or drifted, then, ideally what you want to do before you even replace the teeth is actually straighten your teeth so that the place will be adequate, and you're going to be reducing those kind of problems. In fact, talking about food impaction, there was another patient that I can remember whose point, or concern was that, food was always getting stuck between her teeth, and it's very painful, right? And that was the main concern. But in those kind of instances, those are the recommendation would be to have the problem fixed. And sometimes it cannot be fixed to where now, ideally, if the problem is bothersome enough, you may end up needing to have the particular tooth removed. It's okay, I guess, if it's a wisdom tooth, because usually we tend not to replace those teeth. But if it's one of the major teeth that you actually use on a daily basis, you see that now you're going to have a tooth removed and then replaced. It just ends up being so bothersome at all, in many different ways. financially it is, and even emotionally it can end up being a problem. So yes, if you are missing a tooth, especially back teeth, I want to, kind of like emphasize more back teeth, because oftentimes people understand that if they have a front tooth missing, for aesthetic reason, in order to, to have a good smile, they will want to actually readily replace those front teeth. But when it comes to back teeth, that's when people tend to be more, neglectful or, casual about just leaving their teeth not replaced. So anyway, there are many ways, that you can actually have teeth replaced, and that's going to be a topic for another day. But today we wanted to emphasize on the importance of actually having your teeth replaced if you are missing those teeth. So if you are a person who are missing a tooth and you're in need of help, we are Healing Wings Dental. I'm Dr. Valerie. We are located at 4101 West Greenwood Boulevard, suite number 317 in Arlington, Texas, and our zip code is 76016. And you can also give us a call at 972-213-0202, or check us out on our website, which is www.healingwingsdental.com, where you can request an appointment, because we are here for you. And trust me, if you come to our office, our staff is well equipped. We're very welcoming. You can find this out, from our Google review. Lots and lots and lots of people are commenting about how, accommodating we are and friendly of an office we are. I find that to be very important, because it's already traumatic enough to have some missing teeth, let alone to go to a place where you feel like you are judged, or, you are belittled perhaps because, you're missing a tooth. The point is, reckoning that you are now in the office and getting everything done in a friendly way, in a comfortable way, so that you can actually regain, your oral health and confidence, and you can soar in life. So that being said, I'm going to leave you today and wish you a very great day. And as always, you be blessed. Take care. Bye.